in succession to the videos what I have been discussing on mnemonics. So this video I'll be mainly focusing upon the very important mnemonics as in tachycardia. So students and viewers, do remember that this video I'll be mainly discussing about the mnemonics as to how we can very easily remember about. So hello viewers, welcome once again to my YouTube channel, and in succession to the videos what I have been discussing on mnemonics. So today's video again I'll be discussing upon a very important question what has been very frequently asked in your professional exams for when you are supposed to write about the causes of tachycardia. So in this video I'll be discussing about the important causes of tachycardia and the mnemonics as to how we can very easily remember the tachycardia causes in the professional exams. So students beginning with in the professional exams. So students beginning with, so the normal heart rate, so the normal heart rate in an individual, in a human being, so the normal heart rate in an individual, in a human being, the normal heart rate is somewhere around 60 to 100 beats per minute. 60 to 100 beats per minute. But in conditions of tachycardia, what do we find is that the heart rate is going to be above 100 beats per minute. So viewers, do remember, if the heart rate is going to rise above 100 beats per minute, the condition it is called as tachycardia, which is increased heart rate. So in this video, I'll be mainly emphasizing on the mnemonics as to how we can very easily remember and pen down in sequence the causes of tachycardia in the professional exams. So I have made a simple mnemonic from the alphabets A, B, C, D, E, F, G, H. Just by remembering the initials of these letters A, B, C, D, E, F, G, H, we can very easily pen down in sequence the causes of tachycardia in the professional exams. So viewers, starting with, so what do we find is the A of the tachycardia, the A of the mnemonic is referring to anemia and alcohol excess. So do remember, in conditions of anemia, when the red blood cells count is very low, in such situations also the condition of tachycardia can be seen. Apart from this, if the person is consuming excess of an alcohol, so excess of alcohol consumption, for example, it's mostly said that 14 drinks per for male and less than more than 7 drinks for female, that this kind of an excess of alcohol can precipitate tachycardia in males and females. So the A of the mnemonic is going to refer to the anemia, the atropine, that is that it is a drug, and the alcohol excess. Now moving on to the next alphabet, that is B. So B refers to in conditions of blood loss. So whenever there is blood loss, the condition of tachycardia can be seen. Apart from this, C, the C of the mnemonic is going to refer to the congestive heart failure and caffeine. So in conditions of congestive heart failure, that is CHF, and excess of caffeine, that also causes tachycardia. So this is alphabet C is referring to. Apart from this, the next cause of the tachycardia can be penned down in sequence, that there are certain drugs. So drugs like salbutamol. So these drugs also cause an increase in the heart rate. So the D is referring to the drugs like salbutamol. Apart from next, the next alphabet, that is E, is referring to the exercise and emotions. So students and viewers, do remember, the E is referring to exercise and emotions. So in conditions of exercise and emotions, the heart rate is going to increase. So such a situation can also cause tachycardia. The next is F stands for fever. So in conditions of fever also, there is found that the heart rate is increased and it is mostly above 100 beats per minute. So the next alphabet, that is F, was referring to fever. Apart from this, the G of the mnemonic is referring to the gastroesophageal reflux disease. So in gastroesophageal reflux disease, it is found that just because the acid reflux is there, that is going to cause the stress hormones to be released, and these stress hormones ultimately is going to cause an increase in the heart rate, which will manifest in the form of tachycardia or increased heart rate. The next alphabet, that is H, is referring to very, very important. Just remember these, there are 3, 4 H's. So do remember the in conditions of hyperthyroidism. So the conditions of hyperthyroidism, the heart rate is increased, that is tachycardia can be seen there. In conditions of heart attack also, the heart rate is increased. So this H is referring to the hyperthyroidism, the heart attack. In conditions of high blood pressure also, we can find that the heart rate has increased. So again, this is a situation of tachycardia. And last but not the least, that is in conditions of hypoglycemia. So this hypoglycemia can be due to certain kind of an excess of insulin intake, or in certain conditions of hypoglycemia also, there is increase in heart rate, which is called as tachycardia. So students and viewers, was a very short video where I have tried my level best to simplify the causes of tachycardia in the form of simple mnemonics we can remember. And just by remembering the alphabets, that is A, B, C, D, E, F, G and H, we can pen down in sequence that what are the causes of tachycardia, and we can very easily write it in the professional exams. So students and viewers who are new to my channel, who haven't subscribed, subscribe, and if you like this video, give this video a thumbs up. Just by remembering this mnemonic, that is A, B, C, D, E, F, G, H, you can pen down in sequence the causes of tachycardia in the professional exams very easily. So A is referring to what, B is referring to what, C is referring to what. Just by remembering this, we can pen down in sequence all the causes of tachycardia just by remembering the mnemonic from A to H. So students, this was a very short video. If you like this video, give this video a thumbs up. I'll be uploading more mnemonics on general medicine and surgery. So stay connected. If you like this video, give this video a thumbs up. So this was a very short mnemonic for remembering the causes of tachycardia. So if you like this video, share amongst your friends, and thank you for watching.